Hello dear friends, I am going to present two cases of eustachian tube dysfunction. The first case has a retraction pocket in both ears. So we prepared this patient for eustachian tube dilatation with a balloon. So first step is that we have to insert a balloon. We have to see the eustachian tube opening first and then insert the balloon in the eustachian tube. Gently we have to insert so that it is right into the cavity of the eustachian tube. Once we are sure that balloon is in the right place, which is guided to us by a marker over the catheter, so we start inflating the balloon. So there are black markers, they are provided in the sinus catheter, and then a marker is over the balloon. So we have to keep the balloon for inflated for at least 2 minutes at the 10 to 12 atmospheric pressure. So once the time is up for 2 minutes, gently take away the water and then slowly come outside. And now you see, so earlier there was deep retraction pocket, and then slowly retraction pocket is little bit better now. So again, going to right side, we have inserted the eustachian tube catheter guide into the eustachian tube, and through this guide we are inserting the balloon. So there is a marker over the balloon, so that black arrow, that marker has to be outside the opening of a guide catheter. So once we are sure it is in the right place, and then we see it is inserted into the cavity with the eustachian tube, so we start inflating the balloon with the water, and here we are giving the 12 atmosphere pressure. So pressure can be raised up to 10 to 12 atmosphere, and then you see immediately on table when we examine the ear, there is dilatation of ballooning of a tympanic membrane. So this is second patient. Again, the patient had chronic eustachian tube dysfunction. He was not responding to the medication. So here again we are inserting the balloon by a eustachian tube guide catheter into the eustachian tube. Sometimes the eustachian tube opening is covered with the posterior end of the turbinate, and which is granular and mucosal. So better to take away that part of the turbinate to have a good exposure, especially if you are doing it under general anesthesia. It is easy. So these patients are under general anesthesia. So 10 atmospheric pressure has been attained, and time is for 2 minutes. So in children, protocols are a little bit different, but in adults the pressure is 10. And now you see there is nice ballooning of the tympanic membrane, and now with medication these ears will immediately respond. So again, coming to the opposite side, so again this patient has bilateral problem. So you see, as the balloon is passed through the eustachian tube catheter, there is a black arrow which we can see. The black arrow has to be at the opening of the eustachian tube. So again, the pressure is very important. So don't be very high on the pressure, and it should not be exceeding more than 2 minutes. So that is the pressure. Although it is not a final outcome, so patient may have 2 to 3 sittings or maybe more than that, but many patients respond in one sitting, and it is guided by a questionnaire given to the patient pre-operatively and post-operatively. Thank you so much.